Buenos dias and welcome to More Colombian Than Arepa podcast. I'm Sam, your host, and this podcast is all about answering your burning questions about life in Colombia, traveling through Colombia, and pretty much everything Colombia. Today, we're diving into a topic that every expat, every tourist, and every digital nomad should care about: healthcare. I'm joined by Dr. Luisa, a bilingual doctor based right here in Colombia who works with both locals and foreigners. She's breaking down how to find the right doctors, what to do in a medical emergency, how the Colombian health system actually works, and why you don't need to panic if you forget to pack your entire medicine cabinet while you're here. This episode is packed with tips that could literally save your life, so let's get right into it.
That's it.
Thank you so much for joining the podcast. I am so happy to have you here. I actually met you at Otro Bagel, and
Yes.
It was such a blessing because I have not had or found a doctor who speaks English who could at least help me point me in the right direction. And so when we first started talking, it was just such a blessing because I'm looking for a doctor myself. And it was just so great to meet you and have these conversations with you. So thank you for joining the podcast today. I'd love for you to introduce yourself, tell everyone a little bit about you, tell them where you're from, where you studied, and all the fun stuff.
Okay, good. Well, I want to thank you for inviting me. And yeah, of course. So my name is Luisa Mejía. I'm 34 years old. I have a kid, okay? And I have my private practice here in Medellín. We have a clinic, a center. It's a private practice, as I was telling you, and we are focusing, urgent care services for experts and, functional medicine services too, okay? IV therapies, peptides, things to increase your health experience in general. At this point, the 90% of my patients are experts, and just the 10% are locals at this point. Okay, so it's great. I'm happy to help you with some information for your for your people.
No,
for sure.
that's fantastic. So are you from Medellin or?
I'm 100% paisa.
Yes,
Yeah.
I love it. You're a beautiful Paisa woman.
Thank you.
Do you have, where did you go to school?
Okay, I went to I studied medicine at San Martin. We call it Harvard Teen. Yeah, because it's a great school for medicine.
Yeah.
Yeah.
And how long have you been practicing?
Well, I have been practicing the last 14 years now.
wow.
Yeah.
Okay.
The first 9 years I was in the in the public service in the biggest hospital of Medellin. So my experience is in the emergency room all the time. So that's why I think it's great to have in a urgent care service at this point, because I really know how to approach more like urgent stuff
Yes.
for the patients.
For sure.
Yeah, and after that, after the 9 years, I specialize in functional medicine. So it's like both services. Okay, normally a patient comes comes to me for an emergency or a small thing happening with the health, and it's common to start working in other stuff. Okay, like I don't know, weight loss, okay, fatigue syndromes, post-COVID syndromes, that kind of stuff, okay? So,
Interesting.
yeah.
No, that's fascinating. So now you own your own private practice.
Yes, that's right.
That's awesome. Do you have many doctors on your team or nurses, or how does that work?
We have a nurse,
Okay.
we have another doctor,
Amazing.
and we have a psychologist.
Everyone bilingual?
Yes, of
That is
course.
so awesome.
Yeah,
That
yeah.
is so amazing. Does your psychologist do counseling sessions or anything?
Yeah, of course. He used to live in the U.S.
Okay.
He has perfect English,
Okay.
and he does like the normal psychological approach,
Yeah.
but he has combined like the therapies with holistic therapies, more like Asian therapy was like like
The more naturopathy or something. Yeah.
things like that, more like ayahuasca, that kind of stuff.
Yeah.
Like magic mushrooms.
Yeah. Oh, so interesting.
Yes, he's amazing.
That's okay. Good for you first for starting your own private practice. I can imagine that was scary and exciting, and it's probably a lot of work.
It is scary until now. It's still scary a little bit.
Yes. But like you're 34, that's so cool that you've been able to accomplish this. So I want to ask the biggest question that I'm sure everyone is listening right now and is like, how do you speak English so well? And like, this is hard in the medical world. It's part of the reason I'm so scared to go to doctors because I do speak Spanish, but I don't know all the medical terms in Spanish. So it totally intimidates me. So how do you speak perfect English? And then how have you learned these like vocabulary things to be able to help people with maybe very random things that are going on with their body?
Okay. Well, I never went to a language school or something like that. It's crazy. I don't know, like playing video games, watching movies.
Wait, what? No.
Yeah, like listening to music, things like that. And after that, when I start practicing just with experts, obviously I was practicing a lot, so it made me fluent. Now the technical vocabulary,
right?
Well, normally we study in English. We do a lot of we need to read a lot of papers that are in English. So
that makes sense.
yes, the technical part was pretty easy. Okay.
Interesting. In school, did you do your classes in English or were they all in Spanish?
No, they were in Spanish, but the papers in general, the investigations,
yes.
articles, all the kind of stuff are in English.
That's amazing. And like, look at you now. You literally speak it so perfectly from like video games and music and TV shows and then these articles like read at school. Like, bravo.
Thank you.
If I speak Spanish someday, like you speak English.
You do.
No, that's amazing because I think, like I was saying, I think that's one of the biggest insecurities or biggest things that scare me when it comes to moving to a new country, that you don't speak their language fluently. Because like what happened with my dog earlier this year, it's slightly different because it's a vet, but she went into anaphylactic shock into the vet, and all of a sudden there were like 5 vets in the room and they were just putting vaccines or putting like shots in her, and I could see her like kind of collapsing, and I was in total panic because all my Spanish I knew just disappeared. You know what I mean? When you're in these situations where it's scary or you might not know, and like seeing a doctor in general is never like the best thing because it means like unless you're going in for a general checkup, but it just means that you need to like get something looked at, and it's a little nerve-wracking. So I think having someone who is not only as like warm and comfortable like you are to be able to talk, and I'm sure your whole team is, but to be able to do it in our native language or in a language that maybe foreigners is like their second language is so comforting.
Yeah, it is. It is obviously when you are with a medical condition, you are scared for your health, for your life.
Right.
Okay, you are not understanding what is happening to you.
Right.
So yeah, that's my experience. People feel more comfortable if they can, speak directly, understand the explanation from the professional that is providing the service.
Yeah.
So yeah, for sure, it is important to feel comfortable when you feel this vulnerable.
Yes, that's like such a good way to put it. That is such. So how did you get into working with expats and foreigners? How was that like your journey into that world?
Well, like I think it's coincidence, like things that just happened. I was working in a private service for patients in general, and then some people from the US that were living here started asking for consultations. Okay, so I went there, I tried to speak the best English that I can, and they were happy because they are having the kind of service that they really need to understand what the doctor needs to say. So they start like asking for more consultations more frequently, and I just think to myself, well, maybe there's another people with these needs, and I start offering my services as a doctor for experts. Okay,
That's amazing.
yes.
And
Yes,
do you
yes.
go in person, like, or do they come to your office, or can you do home visits? What are you usually doing?
I do everything. I do telehealth consultations, in-office consultations, and at-home consultations too.
Wow.
Yeah.
So, okay, here's now, let's start with like two different avenues. One are for people who are here for like maybe 3 months, 4 months. They don't need to go into Sura or like one of the health insurance plans here.
Yeah.
They have their own travel insurance. They're fairly healthy people, but let's say something happens and they're like, I need to go see a doctor right now.
Okay.
Like, how, for those people, can they come to your private practice? Do they have to go to the emergency room? Like, how does it work for foreigners that are more like short term, that don't have the insurance plans here in Colombia? Like, how do you start that? How do you get that going?
It depends, okay?
Okay.
And like, if you have an emergency,
Yeah.
like a life-threatening situation,
Yes.
you need to go directly to an ER, okay? In an ER, you will find, the fast laboratories, the images, the specialists that you will need
Yes.
in that case, okay? So don't hesitate if you feel that you are like unstable in general, you need to go to a ER, okay? At that point, I really think that the language is like a secondary thing, okay? You're vulnerable, you need to understand, but it's better for a professional to approach the situation, okay?
And they have all the equipment there, and like that's where they need to go for like, yeah.
Yes. But if you have another kind of condition like, I don't know, a flu, a strep throat,
Yeah.
you're feeling really bad. I understand, but it's not life-threatening, okay? So the idea there, you can find services like mine, okay, in which, I don't know, you need to see me and I can see you like in the next 2 hours.
Okay.
So it's pretty fast and easy,
Yeah,
okay?
it's fast.
Yeah. Normally in an emergency room, if you go for it, for a strep throat, for example, you will need to wait hours.
Yeah, exactly.
Yes, hours, like in the waiting room, okay? So, my recommendation will be, if it's something that you can manage in an urgent care, something simple, a small injury, things like that, go to a urgent care service.
Urgent care service.
Yes.
Okay, which is what you would kind of consider yourself, urgent care?
Yes.
Más o
Yes.
menos. Like, kind of, yes, yeah.
Yeah, of course. I have like fast consultation.
Yeah.
And we have everything. We have the lab, we have the images in case you need it, the therapies, and an IV room in case you need therapies, that kind of stuff, okay?
Awesome. Yeah, that's good. So here's a question that I think that that foreigners would probably have to that, like a follow-up question. Number one, no, multiple. Apparently not one, because I just came up with like 3 more. Number one would be the cost.
Okay.
How much would it cost? I mean, ballpark. Doesn't have to be like, it's going to be 50,000. Like, just how much would a foreigner have to pay to go to an emergency room if they were in a life-threatening situation? And how much would they have to pay for like a private service like yours, going to your office or having you come to their home when they don't have insurance here, kind of situation?
So if you go directly to an emergency room, and your condition is something that you can do like an administrative process, they're going to ask you for a deposit between $1,000 to $2,000 US dollars. Okay. Normally they have like your credit card or things like that, and they're going to charge at the end of the service whatever was like belong to the service. Okay.
Like a surgery or X-rays or whatever.
Yes.
Okay. Got it.
Yes, I'm not telling that you are going to expand the whole.
Totally. Yeah.
Okay, in that area. And for the urgent care services or things like that, you can have a telehealth consultation for simple stuff or for a prescription or things like that, around $75. Okay. For in-office consultation is going to be $100.
Okay.
And if you need for the doctor to go to your place directly, it will be around $175.
Got it.
Okay.
Perfect. It's good to know because I think like it's, you know, I'm from the United States. The United States, the healthcare there is just so much money. So I think people really don't go to the ER when they should be going to the ER because they don't want to have to pay it, right?
Yeah.
Especially if you're not insured. So for all of you foreigners that are from the United States that are probably thinking like, how much is it going to cost for, you know, x-rays or surgery? Like realistically, I know you probably don't know this like completely off the top of your head either, but if they did need like a surgery last minute, let's say they had appendicitis or something that they had to go in and get a surgery for, do you know approximately how much that would cost?
Yeah, well, with appendicitis, exactly, because I had a patient that has the whole thing. I sent it to the ER, and they charge him like $1,500
US dollars.
Yes. For the whole thing.
For the whole thing.
He needed to be in the hospital for 5 days because it was complicated.
Right.
So even being something like that, my way to see it is not that expensive. No.
And you have to understand, if you're listening to this, like Colombia has one of the best healthcares in all of Latin America and is ranked in the top in the whole world too. Like healthcare here is such high quality, and like doctors like yourself, like you all are high quality doctors. And I think what makes it really different from the United States too is every doctor that I've been to or I've encountered is it's not like a 10-minute thing. It's, you want to understand what the problem is and you're willing to give the time to figure out what the solutions are, which is not just like giving medicines and, you know, giving shots or whatever. I think that that's really special about Colombia.
Yes, I think it's like a mix between, you know, our culture and, you know, the profession. Okay, so we are scientists for sure. We go through all the process of, you know, knowing how the body works, how the medicine works, all that kind of stuff. And in the cultural side, I can say that we are pretty humanitarian and close to our patients. Yeah, more caring. Okay. And I really want you to understand what is happening to you and why you are taking those medicines. So I think we have great professionals, like in the scientist level. Okay. And great humans too.
Absolutely.
We have everything. Of course, you can find a bad doctor, but in general, I can say that we are pretty close to our patients.
I love how you explained that. You literally explained exactly one of the things that I'm trying to tell people all the time. Like the culture in Colombia is such like a communal culture and people care. Even if it's people you don't know, they care, you know? And I think that is so beautiful how you put that, because it's reflected in the healthcare too. It's funny, and you'll probably not even think twice about this, but Nick went to the doctor just for like a general checkup, and he found an English-speaking male doctor. So I was looking for a female doctor for my own reasons, but he went to a male doctor, and literally the doctor was like, "Oh yeah, just email me whenever you need anything.
Of course,
just send me an email." I'm like, in the United States, we have to log into the portal. We have to like put everything into the portal. We'll get like some canned response sometimes. Literally, I have his Gmail account.
Yes.
You know? Like, I'm sure you give out your
I provide my phone number. All my patients can find me via WhatsApp.
I love it. That literally makes my day. Like, I just love that too. That's so awesome.
I do it for my own peace of mind. Because, you know, you are here, you are alone, you don't know what to do. I need you to tell me how it's going with the treatment, or if anything is, you know, I want to know. I want to help. So,
I love that. Gosh, you're so good. You're so good. Okay, so that was for the group of people that are here short term or maybe long term, but they're not on any kind of Colombian insurance here. Now let's talk about people in like my category, for example. We live here permanently, so it means that we have to get onto insurance plans.
Yeah.
Now we've done a podcast on different types of healthcare. What words am I saying right now? Different types of healthcare insurances. There are multiple different kinds. There's EPS, which is just like the entry level. Everyone has to have EPS. But I'm specifically talking about people who have the the classic version or like the higher private versions of health insurance here. One of the most popular of those health insurance, if you're just listening and you're trying to find a good one, is Sura.
Yes, it is.
And Sura is like a very good, high quality private health insurance. And there is like hospitals, like Sura hospitals that you can go to, that you can talk to the Sura doctors, all that kind of stuff. But it's hard to find private practices where they accept Sura. And I know that that's a hindrance for a lot of foreigners who live here because a lot of the people at these Sura hospitals do not speak English.
Yes.
So they, again, feel that like a discomfort about going, even though they have health insurance here. So what would you suggest for that? First, does your private practice accept private health insurance as well? Like, does it pay for the whole cost? And then second, what would you recommend to people if they're looking for like a dermatologist or like a specialist in the field that might be outside of what your private practice does?
Okay, so, first of all, we receive Sura. Well, Sura just need like the invoice of the service, and normally they reimburse around 50 to 80% of the consultation, depending on the kind of plan that you have with them, okay? And the second one, what was the second question? Sorry.
I asked you like 17 questions in that one. As soon as I said that, I was like, wow, that was a lot of questions in one. I don't even remember what I said. Confirming, you accept Sura as a private practice.
Yes. Well, more than this, I'm going to give you like an invoice.
Okay.
And you can send it via mail to Sura, and they're going to reimburse between the 50 to 80% of the consultation.
So the person, like if I were to come to you, I pay you the price, and then I would submit it.
Yes.
Including in-home visits. Like that includes all of your services.
Yes, of course.
And does that include like your psychologist too?
Well,
or is that different?
I can give you that info.
Okay.
Like after I can.
Okay. I know. I'm like, get me all your information.
Yeah, sure.
Okay. So the second question that I think I asked, because at this point I don't even remember because it was like 14 questions. But the second question that I wanted to ask was, how do people with insurance go about finding doctors like dermatologists or like specialty doctors that maybe speak English, maybe like, you know what, like for example, I want to go see a dermatologist. I know it's not part of your private practice. So how do I go about finding a dermatologist for myself that speaks English if possible, but if not, like, how do I just go about that?
Okay, yeah. I don't have those specialists directly.
Okay.
But let's say that I have built an environment or like a process where I can have referrals to dermatologists, urologists, a lot of specialists that can speak really good English. Okay, so even if you are not having a consultation directly with me, I can give you the information when you need it. Yeah, it's not that easy. Okay, it's not like. Well, there's some apps and pages like Doctoralia. Okay, that is like a page for finding specialists.
Okay, what is it?
It's called Doctoralia.
Doctoralia.
Yeah.
I'm going to put this in the show notes below so that people can access that.
Sure, they can find me there. But they can find whatever they need, okay? So it's like if you need a dermatologist, you can put dermatologist and English. So they are going to show you the one that can speak English.
Right. Or if they're like, I don't know, they can contact you as well.
Yeah, no problem. You don't need to have like a consultation with me or something like that.
No.
If you need it and I cannot do anything for you, I will give you directly the information of the specialist.
That's so helpful because I do know that that's something that people really really get nervous about, you know? So especially with like, I feel like general health may be a little bit easier, but if you have any, like, I wouldn't know how to say mole or like anything like that in Spanish. You know what I mean? Like I'd be like, oh, this, you know, which would work. But I think that knowing that there are people out there that can help.
But you know what? I want to tell you something about that. It's a difference that I can notice with my patients.
Okay.
So I'm going to say this, okay?
Yes.
In the US, like the professional is pretty centered in something, okay? The mole is just for the dermatologist or things like that, okay? If you have this, if you have this here, you need the specialist in neck, okay? Here in Colombia, we have like a broader view of everything. So if you find a general practitioner that is well trained, you will find one that is going to take them all out, okay, and send them to pathology and know what it is. Yeah, I do a lot of.
Do that?
Yes, I do.
No problem.
No problem. I have a great training in minor surgeries. So yeah, it's not that it's
So
you don't need a specialist for everything.
that is so interesting.
Yes.
Because that is not at all how it is in the United States.
Yeah, I know.
Which I had no idea. I feel like I'm learning so much today too, for like my own personal sake too. But that is so interesting that general doctors can do a lot more than what, you know, is allowed in the United States. Fascinating.
Yes, when we are in medical school, it's like this. After my first year in school, I start practicing directly with my patients, you know, having contact. You know,
Really?
I made my first stitches like when I was like in the second year.
Are you serious?
Yes, we practice a lot and pretty early in our careers.
Love that.
I love that too.
So, and it probably makes your job more interesting because you're like, you can do it all. Like you have, it's not the same every day. You get to like do a lot of things.
Yeah, I remember that a lot of you know, people from Europe and the US comes to make some practices here, and they were surprised because, you know, we were like in the same level, but they didn't know how to touch a patient, how to, you know, approach everything. They only have like the theory in general, but not the experience of working with the patient.
Absolutely. 1000%. I totally agree with that. I have a quick question then. So if you worked with a client, like let's say I have a stomach ache, a really bad one, and I'm like, I just feel like something's off, you know? And we have conversations. You do the lab work at your private practice. You maybe do like an x-ray or whatever it might be. Like something is off and you're like, something is off. And we find out that there needs to be some kind of surgery done. Like, how does that work for you then? Do you prescribe a surgery to go to Sura, or like, how would that process work?
Well, it depends. If the patient has like the insurance and all the kind of stuff, well, normally I make a referral to a great hospital, a good hospital, such as like Pablo Tobón Uribe. It's great. Clínica Medellín here in Poblado. And the other one that is top notch is Rosario. Rosario in Tesoro. It's a great hospital. Okay, so it's like that. If you have your insurance and all that kind of stuff, go there. Okay,
and you'll just put them to the right surgeons, and you like.
Even I have friends there. I'm sending a patient. Please help me with all the process and all that.
Do you go?
Well, just once. Okay. Just once. I needed to help the patient.
Got it. Okay, sorry, I interrupted you.
Yeah.
So you send them to the hospital.
Yes.
Okay.
In general. And I talked to my colleagues about it, and that's all in general. Yeah. And if you don't have an insurance and you have, I don't know, you don't have that much money or things like that. So as I told you, I have some friends, specialists that speak really good English. So it depends. If you have something like, I don't know, stones in your gallbladder, okay? It's urgent, but it's not an emergency, okay? So I talk directly with my friends, my colleagues, and we plan the surgery, okay? In a better price that being in a hospital, things like that. But if you have appendicitis, for sure you're going to the hospital.
You're going to the hospital.
Yeah.
But like quick, like gallbladders or bladder, like
It's painful.
UTIs.
Yes,
Right, exactly.
UTIs, things like kidney stones.
Yes. Oh.
Yeah, that's horrible. It's very painful. But I can talk with the urologist, plan the surgery for the next day. Things like that happens.
That's so, I feel like that brings me so much peace too, because I'm just like, what would I do in a situation where I'm like, help, something's wrong, And like, I think that happens a lot. A
Yes.
lot of people, that happens to a lot of people. And so it's good to hear like the process of how everything works, because I think a lot of people will really, really benefit from something like that. So what other things would be tips that you would give foreigners when they're here? I'm mostly focused on, I know you have some clientele that are Colombian, but I'm mostly focusing on foreigners, since this is one of the most common questions we get from foreigners is just like, what happens? What's the healthcare, like that kind of stuff. So what kind of tips would you give foreigners?
Okay, like in general, if someone is coming to Colombia, and people from the US or Europe, or outside of the tropical area,
Yep,
okay, we have a lot of parasite bugs, different bacteria and viruses, because it's just for the climate and yes. So the idea there, I always recommend to start like around 2 weeks before traveling,
Okay.
taking a good kind of probiotics, okay? At least 5 different type of bacteria, okay?
Interesting.
Yeah, and zinc
And
to prevent any kind of gastrointestinal issue, okay?
okay, I love this.
Yes, if you are going to an area where we have malaria infections or things like that, it is important to start taking the prophylaxis. Okay.
Okay. Yes.
Any doctor can give you a prescription for it. Okay.
Okay.
Or if you come to a big city in Colombia,
Right.
you can ask the consultation for that kind of prescriptions. Okay. What else? Try to avoid tap water, of course. Tap water here or in other places of the world, we have a good quality of water, but it's new for your body.
Exactly.
So it has different toxins.
Right,
Okay.
right,
Different things that can give you like traveler's diarrhea. Okay.
Right. Exactly.
So if you are going to stay for like you can be used to tap water.
At this point.
Yeah, at this point. But people that is going to be here like 2 weeks, okay? A traveler's diarrhea can really damage your plants. Yeah. So the idea is to prevent that kind of stuff, just eating cooked food. Okay. If you're going to take fruit, it needs to be that kind of fruit that needs peeling. Yeah.
Okay.
Yes, and avoid having juices. Raw vegetables like salads and things like that. Yeah. So that's like the general recommendation for the general symptoms. Okay.
Especially outside of Medellin. 'Cause
Yes.
Medellin has it has potable. Is that how you say it in Spanish?
Yeah.
It has like drinking water. You
Yes.
can drink the water if you're showering and you swallow the water. It's totally fine and
Yeah.
clean. And like with salads, it's probably okay too. But anywhere outside of Medellin, you would and in Medellin.
Well, even in Medellin, if you're going to be here for a short time, for a short term of time, I think it's better to prevent the infection. Yeah, everything cooked is going to be fine, okay? But it's like this: the water is good, but it has toxins,
Right.
Okay. If I go to the U.S. and take tap water, okay, it's very easy for me to have like symptoms,
Totally,
just because it's something new to my system.
Yeah.
It's like that.
Interesting. Okay. No, I love that. That's
So use
such
bottled
good
water.
tips. Yes. And no, that's amazing. Those kind of tips are exactly what I think people need to hear. Because it is a thing, like having any kind of traveler issues. Speaking of, if they needed to get malaria pills, or like they decided they were going to the Amazon, or I don't know if that's where there's malaria.
Yeah.
Like
Especially there.
Yeah, I can imagine. Or if they needed to, another even just like maybe not necessarily related to travel, but let's say someone's diabetic and they need more insulin because they've run out of insulin or whatever it might be, they can contact you for a telehealth and you could prescribe them those medications.
Yes, we can prescribe in all Colombia. Okay, so no problem.
Okay.
Yeah, that's the idea. If you just need a prescription, you don't need to visit me in the office.
Got it.
You can ask for a telehealth consultation.
Yes.
We can check the medicine that you need. We can check if we have the same kind of medicine because it's an issue sometimes. Okay. And after that, yeah, I can make the prescription.
No problem.
Yeah, no problem. If you're traveling, you use the prescription, the printed prescription to travel.
Any of the
That's all.
pharmacies, then you're good.
In pharmacies, it's pretty easy. Have you noticed we have pharmacies like every block?
Literally 400 of them in one block. Yes.
Yes. It's like that. So it's pretty easy. You have the prescription from the doctor.
Yes.
You show it. You don't even need to print it from your phone. You show it, and they help you with the medicine that you need.
Do pharmacies help with medicines that you need if you have a prescription from their home country, like the United States or somewhere in Europe or Australia?
Sometimes, if it's like OTC, over-the-counter medicines, like essential medicines, yeah, it's going to be easy to find. But for control medication or antibiotics, I please don't use antibiotics on your own. Yeah.
Okay, good to know.
Yeah. Sometimes in pharmacies you can find people that give you the antibiotics without prescription, but you have to go to a doctor to see if you really need the antibiotics, to choose the right antibiotic, okay?
Right.
And to try to prevent complications, like
Right.
using the probiotics after taking that kind of medicine.
Right.
And yeah, sometimes my experience is like people using, of course, you are in a hurry to feel better and all
course,
that.
yeah.
But a lot of wrong treatments just for
Yes.
from the pharmacist's recommendations.
Yes, yeah, for sure. I mean, ultimately, like, what people need. So
Yes.
it's good to have people, especially when it's medications that might be new or foreign, like they might not have the same, like you were saying, like the medication might be different. The antibiotic might be different here than it is in the United States. Like it
Yeah.
might be different. So
It's like the CPAP.
exactly.
In here it's pretty bad.
Is
It's
it?
pretty bad. Yeah. So
Really?
you are so used to the CPAP that you go and buy it in the pharmacy, and it makes everything worse. Okay. Yeah. We need to think about the quality of some medicines. Okay.
Yeah,
Okay.
absolutely.
Yes.
This has been such an enlightening, amazing conversation. I have learned so much from you. Like literally have learned so much. I'm so grateful that you came on and really like talked about this. Like thank you so
Okay, of
much
course.
for your time. And a lot of people, like I said, a lot of people have these questions, and I think that I don't really know the answers, and now I do, and now I know who to point them to if I don't know the answers to it. But I would love, if there's anything else that you would like to say about your private practice or about healthcare in general, anything else you would like to say for it, please feel free to do that if you do, and if not, like that's totally fine too.
Okay. The last tip that I want to say.
Yes, like, give us
it's like don't wait up when you have like the early symptoms. Okay. Don't wait until it's too late or the condition gets too severe to find help. Okay. In general. About me and my center, well, you can find me. You're going to put the information from the WhatsApp and things like that. But you can find me at centroequilibrium.com. Okay. Or on Instagram, you can find me at DRA, like short for doctora. Med functional. Okay.
Wonderful.
You can find me there.
Like Dr. Luisa said, I will put all of these in the show notes below,
Yes.
so people can access your information, your website. If they have additional questions, they can let you know.
Of course.
But that's amazing. Thank you. I'm
Thank you.
So grateful.
Thank you for having me. Thank you.
You're just such an amazing person. I'm so
you.
inspired by you. You're so wonderful. And I can't wait to start using your services. So thank you so much. Maybe we'll have your psychologist on too. That would be so interesting.
Sure, he will.
I know that people ask questions about that too. Like, what about if I need to go to a psychologist? What about if I need counseling? Are there like homeopathic different ways to do things? I'd love to speak with your psychologist too. But thank you so much for coming on. We are so grateful for you. We're actually doing a recording right now too. So if you want to watch us and see Dr. Luisa's amazing, beautiful face, then definitely check us out at YouTube and Spotify, where you can watch our videos. More Colombian Than Arepa. I'm like, I have 7,500 different Instagrams and TikToks now. So, and then if you want to follow our TikTok and Instagram at More Colombian Than Arepa. And then of course, if you want to follow our daily life, go check us out at Colombia_expats. That's a handful, but thank you again.
Yeah, you're welcome. Thanks for having me. Really.
I really super appreciate you, and we'll have to have you back on so that we can have more conversations.
Sure. This is cool.
30 to 45 minutes is just not long enough to talk about health.
Yeah, we can have another one.
Yes. Well, thank you so much, and until next time, hasta pronto.
Bye.